an osteopath because it allows me to be really flexible with the way that I work with people. So as I've done different training across my life, the way that I approach delivering care has changed. And in particular, I've moved towards this space of working with people with more chronic pain and more complex conditions. And it's an area that I really enjoy working in. I grew up in Shepparton, but I moved to Melbourne and I studied at Victoria University and have subsequently worked in all different areas around the world. So in England and in Singapore and, lots of different areas in Australia. I really enjoy working with people who have problems that are a bit more chronic in nature, so longer term, and sometimes the complexity is a little bit higher. So people have tried lots of different things and haven't had much luck. I like the idea of being able to sort of draw a line in the sand and start again and really listen to what people have been going through and see if we can work out a plan to get them out of those tricky spots. Largely by listening to what they've been through at the start or through their journey to understand, so that we're not just repeating the process. And then often incorporating some of the bits that might have been missing for that. So maybe it's education, maybe it's helping plan exercise, but ultimately to work a path out of that problem for them. I have just completed a PhD in the area of chronic pain in the setting of compensable injuries, so people who have work cover or TAC injuries. And that research was all around how do we help people to better interact with those systems to have better outcomes. Yes, I have. So the thing that brought me to this clinic was actually having an injury myself, and that's how I got to meet everyone here, to know that they were kind of experts in this area. I actually had pain in my hip that was really troublesome, and that it really taught me how frustrating and long-term these injuries can be. It also showed me that sometimes just having the support that you need to remind you to just show up is sometimes what gets you over the line, and that was my experience. I enjoy riding a stationary bike, so I have a Peloton and I enjoy getting on that a couple of times a week, and I also try and get to the gym and lift some weights a couple of times a week as well. I have 3 children and that keeps me really busy, so I run around supporting their sports. I'm also the president of the Glen Iris Scorpions Basketball Club, so I enjoy getting into that community sport area. The thing I like about working at Complete is being surrounded by people who are very passionate about their work and who are also experts in their area, so that we're really drawing on that evidence-based practice. I think that suits me. The other thing I really like is having access to the gym. It just means that we can pop out into the gym and try out some of the things we've discussed in the treatment room.